In the 1970s, doctors were prescribing a powerful new pill for severe high blood pressure, and something strange started happening. Not on their heads at first, but on their arms, their faces, their backs. It was such a consistent, unmistakable side effect that a pharmaceutical company took that molecule, put it in a bottle as a liquid you rub on your scalp, and created the most famous hair loss product in the world. That is where minoxidil comes from. What almost nobody realizes is that the original pill never went away. It is still made, still prescribed, and over the last several years, dermatologists have been quietly using it at very low doses, off-label, for hair loss. And there is a specific biological reason it works for a large group of people: that the foam completely failed. Stay with me, because that reason is the second thing on my list. And if you have ever used topical minoxidil faithfully for 6 months and seen absolutely nothing, it may be the explanation you have been looking for. Your doctor probably has not mentioned this, not because they are hiding it, and not because it is a secret. For a reason I will explain properly at the end. I'm Dr. Alan Brooks. I have spent 35 years as a board-certified dermatologist focused on hair and scalp, and more than 10,000 patients have sat across my desk. And I have watched this particular story unfold across my whole career. From the original blood pressure drug, to the foam arriving on pharmacy shelves, to the last few years where the oral form has quietly come back into dermatology through a completely different door. It is one of the more interesting stories in my field, and it matters to you, because a significant number of people who were told minoxidil does not work for them were never actually given a fair test of it. This channel is where I say what I never have time to say in a 15-minute visit. Maybe you are one of them. You bought the foam. You used it twice a day, faithfully, for 6 months or a year. You pushed through the shedding phase, you dealt with the greasy hair and the itchy scalp, and at the end of it, you looked in the mirror and nothing had changed. And you concluded that your hair loss was simply beyond help, and you stopped. If that is you, I want you to hear the rest of this video carefully, because there is a good chance the problem was never your follicles. So let me tell you how minoxidil actually works, because the mechanism is the key to everything that follows. But first, let me finish the story, because the rest of it explains why the pill disappeared from this conversation for 40 years. When that hair growth side effect turned up in blood pressure patients in the 1970s, it was recorded as an unwanted problem. Which it was. Nobody wants their patients growing hair on their cheeks while treating their hypertension. But somebody looked at that problem and saw the opposite of a problem. If the molecule grows hair as a side effect when it circulates through the body, what happens if you put it directly on the scalp instead, where you actually want the hair, and keep it away from everywhere else? That reasoning produced the topical version approved in the late 1980s, and it became one of the best-selling products in the history of hair care. And here is the thing about a commercial success on that scale. It defines the conversation. For decades, minoxidil meant the bottle you rub on your head, full stop, and the original tablet quietly went back to being an obscure blood pressure drug reserved for severe cases, which is what it had always been. There was no company with an interest in reminding anyone that the pill existed, because the pill was cheap, generic, and unpatented, while the foam was a product with a brand and a marketing budget. That is not a conspiracy. That is simply how attention follows money in medicine. The pill did not vanish because it failed. It vanished because nobody was selling it. Now, the mechanism. Minoxidil belongs to a class called potassium channel openers, and what it does in the body is relax and widen blood vessels. That is why it was developed as a blood pressure drug in the first place. And at the high doses used for that purpose, it is genuinely powerful, reserved for severe hypertension that had not responded to anything else. But in the scalp, that vasodilation has a second effect. Widening the small vessels feeding the follicle, improves the supply of oxygen and nutrients reaching the root, and research suggests minoxidil also acts directly on the follicle to prolong the growing phase of the hair cycle and to push resting follicles back into growth. So, it does not touch the hormone driving your hair loss at all. It has no effect on DHT. What it does is improve the growing conditions dramatically, which for a great many people is enough to visibly change their hair. Think of your scalp as a garden. Minoxidil does not fix the soil. It turns the water back on, hard. Now here is the part that turns this from a history lesson into something that might matter to you personally. When you apply minoxidil to your scalp as a foam or liquid, the molecule you are applying is not actually the active form. Minoxidil is what pharmacologists call a prodrug, meaning it has to be converted into its active version, minoxidil sulfate, before it can do anything at all. And that conversion, when you apply it topically, depends on an enzyme in your scalp, called sulfotransferase. Here is the crucial fact. People vary enormously in how much of that enzyme they have in their scalp tissue. Some people have plenty. Some people have very little. And if you are in that second group, you can rub minoxidil into your scalp twice a day for 2 years with perfect discipline and convert almost none of it into the form that works. You are not doing anything wrong. Your scalp simply cannot activate the drug. This is now understood to be one of the main reasons for what dermatologists call topical minoxidil non-response. And it may account for a substantial share of the people who gave up believing it failed them. And this is precisely where the oral form becomes interesting, because when you swallow it, the conversion happens in your liver rather than your scalp, and it arrives at the follicle already active, bypassing the enzyme problem entirely. That is not a marketing claim. That is the pharmacology. So let me give you the 5 things you need to understand about this, counting down to the answer to the question in the title. Number 5, and the simplest, is that this is not a new drug or an exotic compound. It is the exact same molecule as the foam in your bathroom cabinet, simply delivered through a different route. That matters because people hear pill and imagine something more serious and more experimental than what they are already using. In one sense, it is the same substance. But in another sense, the route changes everything, because a topical treatment mostly stays where you put it, while a tablet circulates through your entire body. That is the trade you are making, and it is a real one. More consistent delivery to every follicle on your head, and effects everywhere else too. Number 4 is those effects everywhere else, and I want to be straightforward about them rather than glossing over them. The most common by a wide margin is unwanted hair growth in places you did not ask for it, which is the very side effect that started this whole story in the 1970s. Face, arms, back, the sides of the cheeks. For some men, that is a shrug. For most women, it is a serious consideration, and often the deciding factor, and it needs to be discussed honestly before starting, rather than discovered afterwards. The second effect worth knowing is fluid retention, sometimes showing as puffiness around the ankles or the face, or a small increase in weight, because remember, this drug affects blood vessels throughout your body. Less commonly, people notice a racing heart, lightheadedness, or headaches, particularly early on. Most of these are dose-related and manageable with medical supervision, which is exactly why supervision is not optional here. The mistake would be treating this like a supplement you can experiment with. It is a cardiovascular drug being used for a cosmetic purpose, and that combination demands a doctor. Number 3 is who should not be taking this at all, and this list matters more than anything else in the video. If you have heart failure, a history of pericardial problems, significant heart disease, or angina, this is a conversation that may well end with your doctor saying no, and rightly so. The original high-dose version carries serious cardiac warnings, and while the very low doses used in dermatology are a different situation, the underlying drug is the same, and your heart is not something to gamble with for hair. If you already take blood pressure medication, this needs careful coordination because you are stacking a vasodilator on top of what you are already taking. If you are pregnant, trying to conceive, or breastfeeding, it is off the table. And if you have kidney problems, it needs specific consideration. This is the section I most want you to remember, because the internet is full of enthusiasm about this drug and remarkably quiet about the people it is genuinely unsuitable for. Now, before I get to the top 2, do something for me. Type in the comments whether you have ever tried topical minoxidil, and if so, whether it did anything for you at all. Yes, no, or you quit before finding out. And tell me your age. I have a strong suspicion that the number of you answering no is going to be higher than most people expect, and after the next point, you will understand why that matters. Number 2 is the payoff to what I explained earlier, and it is the reason this whole subject exists. If you use topical minoxidil correctly and diligently and it did nothing, the most likely explanations are that you did not give it long enough, that you were not applying it over the whole affected area, or that your scalp does not produce enough of that sulfotransferase enzyme to activate it. And that last one is not something you can fix by trying harder or buying a stronger concentration. It is a limitation of the delivery route in your particular body. Which means, and this is the important part, being a topical non-responder does not mean minoxidil does not work for you. It may only mean that applying it to your scalp does not work for you. Those are two completely different statements. And for years, people were handed the first one when the truth was the second. Let me tell you about Thomas, 57, a patient of mine, who arrived thoroughly discouraged, having used the foam twice daily for well over a year with, in his words, absolutely nothing to show for it. He had concluded he was simply one of the unlucky ones, and he had made his peace with it. I explained the enzyme issue, and we discussed the oral route with his own physician involved from the start, because his general health had to be assessed properly first. It suited his situation, and it was prescribed and monitored. At his follow-up months later, he had visible regrowth for the first time in his adult life. The drug had never failed him. The delivery had. And now, number 1, the answer to the question in the title. Why does your doctor rarely mention this? And the answer is not a conspiracy, so let me set that expectation straight away. It comes down to 3 things. First, and most importantly, using oral minoxidil for hair loss is off-label. That means the drug is approved and licensed for high blood pressure, not for hair. And doctors are prescribing it for a purpose outside its official approval. Off-label prescribing is completely legal, extremely common, and often excellent medicine. But it carries a different weight of responsibility, and many doctors are understandably more cautious about volunteering it than about prescribing something with a license for the exact condition. Second, this is a dermatology development. The evidence base has been building mainly over the last several years, largely from dermatology research and practice, and a busy general practitioner who last thought about minoxidil when the foam launched may simply not have it front of mind. Third, and I say this with real sympathy for my colleagues, hair loss is not classified as a medical emergency. And in a 10-minute appointment covering your blood pressure, your cholesterol, and your knee, it is the item that gets dropped. None of that is malice. But it does mean something practical for you. If you want this conversation, you will very likely have to start it yourself, and you may need to ask for a dermatology referral, rather than expecting it to be raised with you. Now, you will have noticed something about this entire video. I have not given you a dose, not once. That is deliberate, and I want to explain why rather than have you assume I forgot. The doses used in dermatology for this are a fraction of the blood pressure doses. They are individualized to the person, and they are adjusted based on response and on side effects over time. Handing out numbers on the internet for a prescription cardiovascular drug would be irresponsible, And it would encourage exactly the thing I most want to prevent, which is people buying this from an overseas website and dosing themselves. That is genuinely dangerous. Please do not do it. This drug requires a prescription, a proper assessment of your heart and your general health, and monitoring. Those are not bureaucratic obstacles. They are the things that make it safe. So here is exactly what to do if this sounds like it might apply to you. First, be honest with yourself about whether you gave topical minoxidil a genuine trial, meaning the correct amount over the whole affected area, for at least 6 months. Because if you did not, that is the cheaper and simpler place to start. Second, if you did, and it truly did nothing, make an appointment and say this: I have used topical minoxidil correctly for over a year without response. And I would like to discuss whether low-dose oral minoxidil is appropriate for me. That sentence tells your doctor immediately that you know what you are asking about. Third, expect and welcome an assessment of your heart and blood pressure before anything is prescribed, and be honest about every medication you already take. Fourth, ask for a dermatology referral if your own doctor is not comfortable, because this sits squarely in dermatology, and there is no shame in either of you saying so. And if after all of that, this is not for you, whether because of your heart, your other medications, or simply because you would rather not take a systemic drug for your hair, that is a completely legitimate choice, and you are not out of options. The botanical route works on different mechanisms entirely, circulation and the hormonal pathway, without circulating through your system. If you want that already assembled rather than blending oils yourself, the ritual I recommend to patients is linked in the description. It is topical and botanical, with no minoxidil and no finasteride in it, which for anyone managing blood pressure or heart medication is a genuinely relevant distinction. One thing, doctor to viewer. Nothing in this video is a recommendation that you take oral minoxidil, because I have no idea about your heart, your kidneys, your other medications, or your history. And those are exactly the things that determine whether this is safe for you. It is a prescription drug used off-label, and it belongs to a proper medical conversation. Do not obtain it without a prescription. Do not take a family member's, and do not adjust any medication you are on. And if your hair loss is sudden, patchy, or comes with other symptoms, that is a different problem needing evaluation in person. I am a doctor, but I am not your doctor. Now, one last honest word, because I think the real lesson here is bigger than one drug. A blood pressure pill grew hair by accident, and it took a pharmaceutical company to turn that accident into the most recognized hair loss product in the world. Then it took another 40 years for medicine to circle back and realize that for a substantial group of people, the original form was the one that would have worked all along. Progress in this field is slow, and it is uneven, and the practical consequence for you is this. Being told something does not work for you is not always the end of the story. Sometimes it means the version you were given did not suit your particular biology, and the question worth asking is not whether to give up, but whether there is another route to the same place. So if you were written off as a non-responder, take that question to a doctor rather than to a comment section. And tell me in the comments whether the foam ever worked for you, and how long you gave it. Type your age too. I read every single one. Take care of yourself. I will see you in the next one.